Have you ever asked yourself, what would I do if I had a heart attack and no one was around to help? You're not alone. Millions of seniors live independently, and while that freedom is beautiful, it comes with real risks. The most dangerous one? Having a heart attack while alone. According to the American Heart Association, more than 70% of out-of-hospital cardiac deaths happen at home, and the majority of those people never called for help in time. But here's the truth: you can survive a heart attack alone if you know exactly what to do in those first critical minutes. In this video, we're going to reveal 7 medically supported, life-saving tips that could mean the difference between life and death. This could be the most important video you watch this year. Because when the clock is ticking, knowledge is power. Let's begin. White heavy checkmark. Tip 1. Learn and recognize the warning signs fast. The biggest mistake people make is waiting too long to act, because they don't realize they're having a heart attack. Most heart attacks don't look like the dramatic movie scenes where someone clutches their chest and collapses. Especially in older adults, the symptoms can be mild, confusing, or feel like indigestion. Here are key signs to recognize. Chest discomfort, pressure, squeezing, or fullness. Not always pain. Shortness of breath, even without chest pain. Pain or discomfort in arms, jaw, neck, back, or stomach. Sudden cold sweat or clammy skin. Unusual fatigue or weakness, especially in women. Dizziness or lightheadedness that comes on suddenly. Warning: many older women experience more subtle symptoms like nausea or vomiting, extreme tiredness, upper back pain, or neck tightness. The rule is simple. If you feel something unusual and it doesn't feel right, act immediately. White heavy checkmark. Tip 2. Call emergency services immediately. Don't second guess. This cannot be stressed enough. Your first action should be calling emergency services. Not your family. Not your doctor. Not your neighbor. Call 911 or your country's emergency number. Here's why. Paramedics can begin treatment on the way to the hospital, buying you valuable time. You cannot treat a heart attack fully at home. Waiting just 5 to 10 minutes to see if it passes can reduce your chance of survival. Telephone receiver: make calling for help the very first step. Even if you're unsure, it's better to be wrong than to be too late. If you have a medical alert device, use it. If you live alone, consider getting one with a fall and heart monitor. Tip 3. Chew an aspirin. It could save your life. As soon as you've called emergency services, chew 325 milligrams full-strength aspirin if you're not allergic and your doctor has given approval. Why chewing? It allows faster absorption into your bloodstream than swallowing whole. Aspirin works by inhibiting blood clots, which are the main cause of most heart attacks. Stop sign important. Do not take aspirin if you're allergic, have bleeding issues, or your doctor has warned against it. Keep aspirin in a known, easy-to-reach spot in your home, next to your bed or in your kitchen. This one small act has been proven to dramatically increase survival chances. White heavy checkmark. Tip 4. Stay calm and control your breathing. Yes, this is hard, but panicking increases heart strain, makes breathing harder, and can worsen your condition. Here's what to do. Sit down or recline in a comfortable semi-upright position. This reduces stress on your heart and lungs. Focus on slow, deep breaths. Inhale through the nose for 4 seconds. Exhale through the mouth for 4 to 6 seconds. Remind yourself, help is on the way. I am in control of this moment. Brain studies show that calming your nervous system during a heart attack can improve oxygen delivery and reduce damage. Practice this technique regularly so it becomes second nature. White heavy checkmark. Tip 5. Understand the truth about cough CPR. There's a lot of misinformation online about cough CPR, a method that involves deep coughing every few seconds to maintain consciousness during a heart attack. Warning: important warning. Cough CPR is only appropriate in very specific situations like a certain kind of arrhythmia and only under medical supervision. For the average person having a heart attack, this technique is not recommended by major heart health organizations, including the American Heart Association. If you feel faint or about to pass out and can't get help, coughing may help briefly, but it should never replace calling for help or chewing aspirin. Loudspeaker. Bottom line: don't rely on cough CPR. Use proven, medically approved methods instead. White heavy checkmark. Tip 6. Unlock your doors and make yourself easy to find. If you've called for help and you're still conscious, this is vital. Unlock your front door immediately so emergency responders can reach you without delay. If you're alone, move toward the entrance if you feel stable enough to do so. Turn on lights at night to make your home more visible. If you collapse behind a locked door, rescuers may be delayed or forced to break in, wasting precious minutes. Also, keep a visible note near the door with emergency contacts and medical conditions for first responders. Tip 7. Prepare an emergency heart attack survival kit in advance. You can't always control when a heart attack strikes, but you can control how ready you are for it. Prepare a small kit with the following. White heavy checkmark a list of your current medications and dosages. White heavy checkmark known allergies or chronic conditions, e.g., diabetes, hypertension. White heavy checkmark emergency contact numbers. White heavy checkmark health insurance card copy. White heavy checkmark 1 to 2 aspirin tablets in a sealed packet. White heavy checkmark your address written clearly for emergency responders. White heavy checkmark medical ID card or bracelet if applicable. Round pushpin keep this kit by your bed, in your handbag or walking aid, near your phone, or pinned on your fridge for visibility. This kit helps paramedics start the right treatment fast, even if you can't speak. A heart attack doesn't have to be a death sentence. Even if you're alone, even if no one is there to help. You are not powerless. You are prepared, but only if you take action before the crisis hits. So, please memorize these steps. Share this video. Talk to your doctor. Set up your emergency kit. Because in the moment of truth, you won't have time to think, you'll need to know. And remember, your life is worth protecting. Your wisdom, your presence, your story, it's not done yet. Older adults, subscribe to Wisdom of Older Age for more videos that could one day save your life or the life of someone you love. Stay informed. Stay safe. And never stop believing in your strength.